There are several types of drugs used to treat disorders of the nervous system and the neuromuscular system. The groups we will be looking at are skeletal muscle relaxants and anticonvulsants. Skeletal muscle relaxants relieve muscle pain or spasms and severe musculoskeletal spasticity. They include Flexeril, Soma, Baclofen, and Valium. The other group is anticonvulsants. Anticonvulsants inhibit neuromuscular transmission and may be used as long-term management of chronic epilepsy or short-term management of acute isolated seizures not caused by epilepsy or trauma to the brain. Anticonvulsants can be classified into several groups. The most common are the hydantoins. A common example is Dilantin. Barbiturates. A common example is phenobarbital. Benzodiazepines. A common example is Klonopin. Carboxylic acid derivatives. A common example is valproic acid. GABA antagonists. A common example is Neurontin. Spasticity is a motor disorder that is characterized by increased muscle tone. To varying degrees, a skeletal muscle relaxant can reduce spasticity. There are two main classes of skeletal muscle relaxant: centrally acting and direct-acting medications. Common medications that may be used are Soma, Detraline, Baclofen, Flexeril, and Xanaflex. Remember to take the medication exactly as prescribed. Don't stop Baclofen or Soma suddenly after long-term therapy. It may cause withdrawal symptoms. Avoid alcohol. Report any difficulties with urination to the doctor if the person is taking Flexeril or Baclofen. Take the drug with food or milk to prevent GI distress. Change positions slowly to help avoid dizzy spells. And be sure to keep regular medical follow-up appointments to evaluate the effects of this drug. Anticonvulsants can control or prevent seizures and may be used for long-term management of recurrent seizures, short-term management of isolated seizures such as those that may occur after trauma or brain surgery, or for emergency treatment of status epilepticus, which is a continuous seizure state. There are several classes of medications that are used to treat seizure activity. The most important thing to remember is that the drug must be taken regularly to be effective. It is important not to change brands or dose forms without talking to the prescribing physician. Don't stop the drug abruptly. The drug must be slowly withdrawn when it's discontinued. Take the medication with food to reduce GI upset and loss of appetite. Wear or carry a medical identification at all times. Don't take over-the-counter medications or herbal preparations without consulting your healthcare provider. Heavy alcohol use may diminish the drug's benefit. Be sure the person keeps all regular medical follow-up appointments and completes routine blood tests to evaluate the effectiveness of the medication. Benzodiazepines may be used to treat many ailments, such as anxiety and tension, sleeplessness, relaxing skeletal muscles, and treating seizures. Common benzodiazepines include Xanax, Valium, Ativan, Restoril, Serax, and Dalmane. Remember, benzodiazepines are controlled substances. Watch for central nervous system and respiratory depression, lethargy, drowsiness, decreased respirations, and decreased levels of consciousness. Enhanced CNS depression when taken with other CNS depressants, alcohol, anticonvulsants. Hormonal contraceptives may increase the risk of flurazepam toxicity. In the past, the long-acting barbiturate, phenobarbital, was one of the most widely used medications to treat seizure disorder. It is used less frequently now because of its sedative effects. Phenobarbital is usually prescribed for the long-term treatment of seizure disorder or for status epilepticus when other medications are not effective. It is important that you remember when your person is taking barbiturates, they may cause physical or psychological dependence. To take as directed. Don't take over-the-counter medication or herbal preparations without the prescriber's approval. They may decrease the effectiveness of oral contraceptives. They may cause impotence. Don't stop taking the drug abruptly. Avoid drinking alcohol. Avoid activities requiring concentration or coordination until the full effects are known. Watch for CNS and respiratory depression. Report skin eruptions or other significant adverse reactions to the prescriber. Also, it is important to remember there may be a decreased effect when taken with rifampin. There is an increased risk of toxicity when taken with Tagamet, central nervous system depressants, Dilantin, and valproic acid. Many drugs' effect are reduced by barbiturates. For instance, tricyclic antidepressants, corticosteroids, digoxin, oral anticoagulants, and hormonal birth control. There is an increased risk of adverse reactions when used with tricyclic antidepressants. Evening primrose oil and herbs or dietary supplements that contain thujones, such as wormwood, sage, and tarragon, or vitamin B6, may decrease the seizure threshold.